one. All right, good afternoon, everybody. In a moment, I'll hand over to the Director-General of Health to give an update on the case investigations around our most recent community cases. I am very pleased to report that there are no new cases detected in the community or in our managed isolation facilities from the test results that were processed overnight. Once the Director-General's given the daily update, I'm going to give you a bit more of an update on what's happening at the Pullman Managed Isolation Facility and then a few other points from me about the decision-making process moving forward, and then we'll open up for questions. Dr Bloomfield.
Thank you, Minister. Kia ora koutou katoa. So as the Minister said, I can confirm that there are no new cases in the community to report at this point, and we had no cases in managed isolation identified in the last 24 hours. Before I move to the Auckland February cases, I do not want to note that we are also formally recording the sad death of a patient with COVID-19 at North Shore Hospital, which we first announced on Saturday the 13th of February. This death has now been included in our official COVID-related death numbers, and so a total of 26 people have now died with COVID-19 in New Zealand. I continue to offer my deepest sympathy to all those affected by COVID-19 and request the privacy of this family and others who knew this person is respected. Now, for an update on the Auckland February cases. The 3 positive cases remain in quarantine at the Auckland Quarantine Facility, and their household contact is under supervision, isolating at home. Our intensive investigation around the potential source of transmission for all 3 cases continues. We have a number of scenarios we are pursuing. Now, as I've said before, it's important we don't jump to any premature conclusions about the source of these cases. And I want to thank the people involved, these 3 people and their contacts, for the excellent information they're contributing to the picture we continue to build. These cases have resulted in a testing surge, and from the 5,818 tests processed nationally yesterday, and which we are reporting on at this point, it's encouraging, very encouraging again. There have been no positive results, and I should say that those test results were up to around midday today. We had no further positive results. Nationally, more than 15,000 swabs were taken yesterday. The results from those tests will continue to be processed over the next 24 to 48 hours, and they will help to inform our actions and, of course, our advice. Just a regional breakdown on those figures. Across the Auckland region, over 10,500 swabs taken yesterday, and there's been additional capacity added to the existing clinics with pop-ups today open at Takanini, Botany and Papatoetoe. As at 11:15 this morning, a further 1,454 swabs had been taken across Auckland. I do want to thank the hard-working staff at these facilities, and as an additional safety precaution, there is a number of infection prevention control processes in place around queues with queue management for the number of people who are turning out. And I do want to also thank general practices and other clinics across Auckland and indeed across the country that have continued to undertake swabbing. Elsewhere yesterday, Taranaki reported 450 swabs, Waikato 750, and there were 260 in Northland. One crucial but sometimes overlooked piece of work is our ongoing cooperation with ESR around wastewater testing in places of interest in Auckland. Now, ESR started this in the middle of last year, and they have continued to refine their methodology. Wastewater testing can detect even a single person who may be shedding the COVID-19 virus. Such testing has got increasingly sensitive and will help to detect any potential infection in the community. The more we sample, the more likely we would pick up something if it was there. And we have initiated daily wastewater testing, which was already underway in Auckland. We have initiated that this week in New Plymouth and in Hamilton. There is a specific site in Auckland that captures the Papatoetoe area. There is a 48-hour lag in reporting, but so far the results have come back negative, and by tomorrow, of course, we will have that important testing from Monday. Contact tracing inquiries have now identified 109 close contacts outside the household. This increases in number is predominantly because of a very precautionary approach to people classified as close contacts at a new location of interest, which was a medical centre waiting room where the father wasn't in the red lane for COVID testing. This was well before he developed any symptoms or indeed tested positive. In addition to the family member close contacts, all the workmates of the father and the people that travelled in the car to Taranaki have tested negative, and there are 14 negative results from the close contacts at Papatoetoe High School out of 36 there, and they will continue to come in during the day. More than 2,000 other contacts have now been identified as Casual Plus and loaded into the National Close Contact Tracing System. This includes people who were at the workplaces of cases B and C, others from Papatoetoe High School and other locations of interest. It's a large number of contacts, and obviously our National Contact Tracing Centre is at full scale supporting Auckland Regional Public Health with surge capacity. There's also, of course, ongoing interest and investigations at Sky Chef as a key workplace here. I mentioned yesterday that we had commissioned an infection prevention control of the laundry process there. That was undertaken as part of the follow-up investigation related to Case B. Overall, the early report is that IPC audit identified that the practices there were very much in commensurate with what we would expect in relation to the health and safety management. There were a couple of small improvements suggested, but they do not impact on the overall assessment there, and that they are appropriate for the workplace, that is the infection prevention control measures. And I want to once again thank this employer, which has been exceedingly helpful and supportive throughout. Finally, regarding testing, as I said yesterday, we took more than 15,000 tests yesterday. This is a great response and exactly what we need, and a reminder that those who don't have symptoms or were not at a place of interest do not need to be tested. Anyone who has been tested because they were at a place of interest and has returned a negative test is now able to go about their daily lives, but of course be aware of symptoms, and if you do develop those, please isolate and seek a test. If you want to find out where to get a test, the very best place is the HealthPoint website. That's healthpoint.co.nz. It has up-to-date information on more than 1,100 testing sites right across the motu, including most GPs. If you look at that website, it means you don't have to call Healthline to find out where to go, and in fact, Healthline has increased its capacity tenfold over the last 24 to 48 hours. But I do want to point people to information either at the HealthPoint website around testing or general information on the COVID-19 government website, so that people who need health advice can get through to Healthline. I also just want to finish on a note of thanking the many New Zealanders who provide very nice messages of thanks to the staff working at our MIQ facility. I received an email yesterday that was extremely appreciative of the work done by defence staff, the nursing team, hospitality and hotel staff at one of our facilities, working to, in their words, protect New Zealanders every day. I share that sentiment, and I dare say that it's feedback like this that really does keep the teams going and doing their best to provide not just excellent service for their guests, but to protect all their fellow New Zealanders. Thank you, Minister.
Thank you, Dr Bloomfield, and if I could also echo the government's thanks to all of our frontline border workers for the incredible contribution they are currently making. A quick update on the Pullman Managed Isolation Facility. This morning the Pullman did begin receiving its first guests following its recent shutdown. This follows an intensive deep cleaning process, a thorough investigation by health officials, and some changes to the way the Pullman facility will operate in the future. We've been very carefully considering the health and well-being of returnees and staff at this facility as we have made those decisions. The facility is initially reopening at 50% of its capacity for the first 2 weeks, and only the lower floors will be occupied. That will allow us to limit the use of lifts within the Pullman. Whilst that is happening, the air filtration systems in the lifts are being upgraded and replaced. That work is expected to be completed later this week. The CCTV upgrade is now complete, and new strict procedures have been implemented that limit people's movement around the Pullman facility. Corridor ventilation will now operate 24 hours a day, significantly reducing the risk of airborne transmission. and protocols are being implemented to control the airflow out of individual rooms. The pre-departure testing and the day 0/1 testing that we have now implemented will also help to reduce the risk of COVID-19 cross-infection within any of our managed isolation facilities. I can also confirm that the lessons learned from this experience and the changes made at the Pullman are being rolled out across the wider MIQ system. The Pullman has been a very important part of our MIQ system. It's received consistently good feedback from returnees, and it will be good to see it returning to full capacity soon. I do want to finish today with a reminder of what Cabinet considers when it comes to any decisions on alert levels in New Zealand. The framework was agreed by Cabinet last year. It's the same framework that we have applied to all of our alert level decisions since May. The first thing that we get, and we always do it in this order, is the advice from the Director General of Health and from his team around the ultimate health risks that we are dealing with. Cabinet considers that advice along with evidence around case numbers, contact tracing, any geographical distribution of cases, including whether that spans across regions, and any connections to the border. We also consider the effects of any change on the economy and society more broadly, including the impact on any particularly at-risk populations. Finally, we consider whether the alert level changes, or changes to alert levels, can be operationalised safely, and the timeframe in which that can occur. So we'll provide more of an update on those considerations around about this time tomorrow. We don't have a confirmed time for when we will make the decision. That will partly depend on the information that we receive in the next 24 hours. Finally, before I open up for questions, I do want to note that it's a Parliament sitting day, and I'm due in the House at 2 o'clock to answer 6 parliamentary questions today, so we'll try and keep this reasonably tight today, but we will provide further updates. There's more information. Jessica.
What do the zero results today mean for our chances of coming, or Auckland's chances of coming out of level 3 tomorrow night?
Too soon to speculate, but a day when we get zero positive test results is always a good day.
We're reading a lot into today, though. There were a lot of testing from the school and from the workplace, so this has got to give us a little bit of a sense that we're on the right track.
Yeah, so as you will have heard from the Director General's update, a number of the swabs taken yesterday, we still haven't had the results back from yet, but the results back that we have had are encouraging. It's good to see, no new positive cases today. Tova.
Is there any update on the potential changes to the frequency of testing border workers, including those peripheral border workers, and the fact that you're even considering those changes, does that suggest that there were flaws in the system?
No, we learn as we move along. At the time we put those testing requirements in place, they were appropriate to the risk that we were dealing with. What we've seen in recent months is that we're dealing with a higher level of risk now as a result of variants that potentially can spread faster and infect more people. And so we have to consider whether we adjust our settings according to that. Now, we haven't just started doing that, we have been doing that since the beginning of the year, and you'll see that with the pre-departure testing, the day 1, day 0 testing that we've been doing. We've been making changes as we've been going along. What we will also look closely at is whether there are any other groups on the periphery of the border that should be brought into the compulsory testing regime. You'll see from our experience now that the laundry worker concerned and her workmates were being tested regularly, though they were not required to be tested. So one of the questions that we will be turning our minds to is whether that should be changed. Now, I do want to sound a word of caution. Tens of thousands of people do interact with our border each day, and so we have to make sure that we're getting that we're drawing the line in the right place as to who needs to be tested. So if you consider the port, for example, goods flow across the port all of the time. Similarly, freight flows through our airport all of the time. Not everybody who is involved in that process is going to be at risk. So we have to always look at how we can continue to refine that.
And saliva testing companies say that claims about saliva tests not being as good as nasal swabs are incorrect. What's the evidence that you have, and perhaps this is for Dr Bloomfield as well, about saliva tests that make you concerned and reluctant to use that type of test more widely?
I'll make a quick comment and then I'll ask Dr Bloomfield to comment on the science. One of the things we do know about saliva testing is that it still requires the same resourcing to process those test results as our PCR tests, but the overall confidence in each individual test result is lower than with PCR. PCR is still around the world regarded as the gold standard test. So we have to consider carefully the impact on our workforces of being more regularly tested, on the capacity to process all of those tests and what that would ultimately mean, and whether that increase actually gives us an extra layer of reassurance, given that we know we'd be more likely to get more false negatives from the saliva testing. So we are doing some saliva testing now. We had begun that before we dealt with the Pullman issue. It was suspended for a brief period of time while we dealt with that. That has resumed now. We're obviously looking very closely at what we learn from that sort of early stage rollout of saliva testing as to whether we want to expand that further. So that's still in its early stages. I'm not going to rule out expanding saliva testing. It would be as an addition to our existing testing regime, not as an alternative to it. But I'll ask the Director General to comment on the science and the validity of the test results.
Just two additional comments. First, I wouldn't say we're reluctant to use it. As the Minister said, we are actually trialling it in a number of our quarantine facilities around the country. I think the second point here is the data we have been, first of all, not all saliva tests are the same, so some are better than others. The data we've presented on the one that there is a company wanting to use here in New Zealand is from North America. We would need to validate that in the New Zealand setting, just as we did with PCR testing at the outset, and that's what we want to do.
I'll come to Jane.
Are you happy with the level of scanning generally? Obviously it goes up, when we have these alerts, but we had Countdown this week saying that some people were just flat out refusing, and they actually said that they would support mandatory scanning. Is that something that you're looking at, given it's such an important part of the response?
One of the reasons that I have been hesitant, I've been looking at this all the way along, is the potential compliance cost that creates, particularly for small businesses. But we will certainly be looking at how we can encourage greater uptake, and I'm not ruling anything out at this point.
Is this something that you can give to businesses? I mean, in that particular instance, the business was trying to enforce it and they had nothing to, enforceable to back them up. Is there something other than a blanket mandatory, rule that you could give businesses to help in that situation? I mean, is there an interim or...
So like I said, that's something that we're looking at, how we can encourage greater uptake, what more tools we can give businesses to encourage people to do.
What sort of thing?
Look, we look at experiences from around the world where they might have, roving groups of people walking around to encourage scanning uptake. That eases some of the pressure on businesses to have to do that for themselves. Bigger businesses do have the ability to do that. So supermarkets are well placed to have someone at the door encouraging people to scan in. And I want to thank those supermarkets that are doing that. For smaller retailers, where they may only have one or two people working at any given point in time, that can be quite a big challenge for them. So
Then that you're not happy with the level of scanning, like overall, not just...
I haven't had the numbers in the last 24 hours. What we do know is when New Zealand responds well when we're dealing with COVID-19. We don't necessarily prepare well. So when we're in a position where people are feeling comfortable, they're not always good at taking those precautionary measures. But when we ask New Zealanders to ramp up because we're responding to something, Kiwis are pretty responsive to that. Now, I imagine that we will see quite a significant spike in our scanning numbers and then it will tail off again as the risk decreases. So the key thing, as we get the numbers up again, which I'm sure we will in the next sort of 48 hours or so, we want to keep them up there, and so we'll be looking at what we can build into the system going forward. Audrey.
Dr Bloomfield, can you just clarify your reference to 2,000 casual plus contacts, and will the tests of them be known when Cabinet meets tomorrow?
Yes, so that includes the non-close contacts from Papatoetoe High School, so the other students who weren't in the same class, plus whānau members. It includes also the people who have come forward because they were at a place of interest, of which there are quite a number. So that's the total there is over 2,000, and most of those are all ones that have been registered and being tested, and so those tests will be being processed today. So yes, it'll be important to have those results back to inform my advice for tomorrow.
Gina.
Just on the places of interest, Dr Bloomfield, you mentioned the medical.
Gina.
Just on the places of interest, Dr Bloomfield, you mentioned the medical.
That's exactly what we're wanting to rule out with the testing we're doing. And so all of the people, for example, around the high school, virtually all of them will be asymptomatic, but we're asking them to be tested. We're also asking anyone in the community who is symptomatic to be tested. So we will detect, we have seen this in the past here, and it's the same in Australia when they respond to their outbreaks, we will detect any other infections that might be out there and any other parallel chains of transmission, which is what we are looking for. Yes, you can't always guarantee 100% you get every single one, and that's why the alert level response is so important, because in restricting movement, even if there is someone who is infected and we don't find it, the likelihood they will infect others is greatly reduced.
Yeah.
Vaccinations, I'm going to just ask one on vaccinations. And with vaccinations that may reduce the symptoms or may cure the person, but it can still be passed on. And if that's the case, what's the point of doing frontline workers?
So just to answer that, yes, the vaccine, and we know that the Pfizer-BioNTech vaccine that we've received is probably amongst the best, is one of the best in terms of protecting people from becoming infected. What we still don't have evidence of, but it doesn't mean that the evidence won't come through, is that it always prevents someone from stopping infecting others, so stops them from from infecting others. So that's the evidence we are looking for. However, we do know, based on other vaccines and on the way that they work, that it would be unlikely that it didn't reduce transmission significantly, because the main factor that makes someone infectious is the amount of virus that they are carrying around. And if they have got either an asymptomatic or a very, very low infection, if they are infected, then the likelihood they will transmit onto others is greatly reduced.
Okay, good.
James, question. Has the government considered, your statement about compliance costs suggests that the onus for scanning in would be placed on the shop to make sure that all their patrons signed in. Why would you automatically place the onus on the premises rather than placing the onus on the person to sign in?
Look, that's one of the things that we'll work our way through, as to whether there should be compulsion. We have stopped short of that up until now, but that is certainly something that I wouldn't take that off the table at this point. But I want to get some more advice on that. I obviously need to, that would be a big decision, so that's something that the Cabinet would want to consider before we make any further decisions on that.
Dr Bloomfield, could you give us an update about the family themselves, what sort of condition they're in, what sort of treatment that they're receiving at the moment?
Yeah, just the latest information I have is that they are being looked after well, of course, at the quarantine facility in Auckland. They're not requiring any high level of care, and I really hope that they are recovering very quickly.
And what's the significance of the daughter potentially developing symptoms first?
Well, that's exactly one of the things we are trying to get to the bottom of, because whilst the mother here worked in the Auckland airport precinct, we shouldn't jump to the conclusion that that's automatically jump to the conclusion that's the root of infection, and especially because the daughter's symptoms seem to have preceded the mother's, we need to rule out that she was the index case, in which case in particular that testing at the high school is really important, and it's pleasing to see all those results so far negative.
Yeah.
Yeah, Dr Bloomfield, back on the saliva testing, I believe you were talking about Rako science there.
Correct.
And health officials are meeting with them later in the week, is that right?
Yes, we've actually met with them already.
Yeah, and have they not already validated their testing method for New Zealand standards?
They have provided data of testing, of validation testing that was done in the USA, but they are working now with Air New Zealand and possibly one or two other large employers to do some saliva testing of their workforces as part of their onshore validation.
Okay, Jessica and then Jenna.
Oh, yeah, I was just keen to know what the difference is, what kind of extra information you were seeking specifically, like what does that mean to get validation? Because as I understand it, they've crossed most of the hurdles they need to operate in New Zealand, if that's the case.
Yes, so the accreditation of their processes, that's fine. The issue here is that the evidence from the US is around where you had someone who was a known positive case from a PCR test, and they were able to validate and say, yes, the saliva test picked that up also, and so they got a high level of correlation. What we are really interested in here, in a situation where we have virtually no or very small numbers of cases, and we need to find every single one, especially if we're using it as a screening tool in our workforce, we want to be sure that those saliva tests would pick up every single case, so we can't afford to have false negatives.
Okay, Jessica.
So with with the testing of the vaccines that was happening yesterday to make sure they made it through the flight okay. Was that okay, and are we still on track for Saturday?
All good news so far. Yes, we are absolutely on track for Saturday. That's the latest advice that I have received.
Just some practical
Jenna.
questions about the vaccination program. Where will those vaccinations happen on Saturday? Will they be administered to border workers at the facilities they're working at or different premises? And do you have a time frame for our next shipment?
I don't have a confirmed timetable for our next shipment yet. I'll let you know as soon as we do, as we did with the last one. In terms of the initial rollout is very much focused on vaccinating our border workers in their workplace as we test them in their workplace, so building it into that process. The goal is to get through them within the 2 to 3 week period, which we currently have a testing cycle for, and then allowing for a little bit of extra time to pick up any who may be missed along the way. So we're certainly on track to be able to do that. As we extend a little bit beyond our border workers, including their family, for example, we'll probably be asking them to come to specific sites that are not the workplace, bearing in mind that we do not necessarily want all the family members going into MIQ facilities in order to get their vaccinations. Up the back here.
How late can you leave the call to change alert levels? I get that a lot of people are thinking that they're probably going to go into a couple more days with the levels as they are. How long can you leave until tomorrow?
Look, ultimately what we do is through the course of the day tomorrow, we'll assess what information we have during the day, and we will decide based on that information when we feel that we're in a good position during that period tomorrow to make a decision. And then one of the things that we consider once we've identified what course of action we then want to follow is how do we operationalise that? And so depending on what decision we make, that may there may be a notice period before that gets implemented. Really, it will just depend on how confident we are of the information we have and how early we get that information, bearing in mind that you want to have as much information as you can before you make a decision. And we've been in this position before where we've thought we could make a decision at a particular time, and then we've realised that actually a few more hours and we would have some more pieces of the puzzle, so we'd wait for a few more hours. So it's all very speculative at this point. I wouldn't want to...
What are the key pieces of the puzzle that you're talking about? What is the main pieces of data that you'll be looking at when making that assessment?
Those ones that I ran through in my introductory remarks. So we're going to be looking at our testing numbers, we're going to be looking at what that's telling us, whether we've identified any additional cases, whether there's more information about our source investigation, whether that's telling us anything new, and whether in fact, again, it comes back to that question of if a few more hours would make a difference, then maybe we take that time. So we'll see all that unfolding tomorrow. Yeah. At this point, the advice that we've had from the Director General and from his team is that we're all quite confident in the alert level settings that we have, and we're reviewing them every day. So we're reviewing them regularly, and at the moment we're still at alert level 2 for the rest of the country. Come over here.
Of the 109 close contacts, how many have returned negative results?
I'll get the Director General to...
So what I can say is that there were all of the closest family and friends contacts have all returned negative results. I gave the figure earlier on about the classroom and teacher contacts from the school, and there is a number of negative results that have come in from the wider group. I think I've got the number here, and I can provide it to you at the end.
Yeah.
You mentioned earlier that we still need to rule out that the daughter was the index case. Could that be the difference tomorrow in advising the government on whether or not we move the levels or whether we don't?
We may not get to the bottom of that, and that won't be critical in terms of our advice. The two key things are, has there been any onward infection from these cases, and is there any parallel infection in the community, parallel chains of transmission or earlier infections that we've identified? So the testing really is the fundamental thing here.
Okay, over there.
On the transmission, you noted that 14 of 36 of the classroom contacts have returned negative results. Is there enough priority on specifically getting those prioritised and tested, those 36 contacts? And yesterday it was 33, so just curious what the 3 extra people are.
So I can't tell you what the 3 extra people are. It would have just been further inquiries to identify, and that would have identified perhaps another school teacher or someone else. Yes, the tests for the close contacts are prioritised for both swabbing and for processing in the laboratory.
Okay, we are going to have to wrap up shortly, so I'll do a couple more questions though. Yep.
Any update on the genome sequencing, and how likely do you think it is that there will
So ESR is continuing to look at all the B117s since really December and seeing if there is not just a possible genomic match, but if the time difference or that there's a possible epidemiological link, and Auckland Regional Public Health is working closely with them on that. The genomic link internationally is still a possibility. We do know that there is quite a bit of the B117 around the globe that's been characterised. Interestingly, there is the variant they have is one that's quite common in a range of countries around the world. So it's quite the B117 is a new variant and seems to be mutating quite slowly. And there has been something they've called a starburst event where there is a number of people in a range of countries that have got the same variant that they were all probably exposed at some point in time or very close to each other. And so it's very worthwhile us and ESR looking at that international database to rule out whether there's a link to one of our existing genomes we have here, or whether it might help confirm that there's been another introduction that we're not aware of.
We'll come over here.
Māori organisations in South Auckland say that they're working beyond what they're resourced for in terms of food and even testing. What supports are available for these? They're marae, for example.
The Ministry of Social Development is working with them at the moment to identify what additional support they need and to make sure that they get it. I do want to just pick up on that theme though. When we're responding to an event like this, I think a lot of organisations find themselves pushed to their absolute limit, particularly those working in the health sector. And so I want to thank them for for working around the clock, as many are at the moment, to meet that need. And that extends to organisations who are helping those in need as well. So a particular thank you to them. I'll let you.
These Māori leaders also met with the DHBs today in Auckland and said that they're concerned that there's no actual plan to roll out targeted vaccines for Māori. Is there a plan?
So the plan that we have around our vaccine rollout is one that's based on risk, and Māori are disproportionately represented in those groups who will receive the vaccine early. So there is a high representation of Māori in those groups because they are in that higher risk category. So we're working very closely with Māori health organisations to make sure that they are ready to help us gear up to deliver those vaccines.
Yeah. Yesterday the Prime Minister indicated there was an opportunity cost to additional testing. What's the maximum number of tests you can do in 24 hours, and do you need to scale that up?
Look, it's not just about the lab capacity to process it, it's also about having the nursing workforce to be able to take the tests and so on. So I haven't got a particular number because that will vary, but what you will see, and you'll see this from your own media coverage, in fact, that the number of people willing to work in these roles is limited. We're actively recruiting all of the time, but in our MIQ facilities, for example, there's a limited number of people willing to do that work, and that is one of the constraints that we're dealing with. So, look, we're always looking for how we can expand our testing capacity. Our lab capacity has increased exponentially, and then so really the challenge at this point for additional testing, whether it's PCR or saliva testing, is that earlier part, getting the swabs to the lab. I'm really going to have to finish up shortly, but I'll let Jenna, and then I'll do a couple more, and then we are going to have to finish. Jenna.
Can you just explain the reticence to do compulsory scanning, because you have mandated businesses to into compliance well before, for instance, masks and hospitality outlets had to have contact registers.
Like I said, we haven't ruled that out at this point. We are considering further how we can ensure that the QR codes are operating as the useful tool that they can be.
How many people in MIQ this year, so since January 1st, have returned positive PCR swabs, but there hasn't been enough genetic material there to actually do a full genome sequencing?
Well, I think I said yesterday we've had 29 historical cases. They would all be in that category, and I can find out whether there are any others of the ones that were judged to be acute cases, and we will provide that information or follow up.
Just one thing you said earlier on the Pullman, you said that you're going to be bringing in strict new procedures to reduce movement in facilities. That hasn't really happened in New Zealand before. In men's isolation facilities, people have been allowed to leave their rooms. Is that changing?
They will still be able to leave their rooms, but it will be supervised and it will be rostered. So people, when they get their exercise, they'll get an allotted time for exercise. If they're smokers, they'll get an allotted time to go smoking, to make it that much easier for us to track where they have been, who they may have been into contact with, and so on, and also just to significantly reduce that risk of any spread amongst our guests.
Will you have to boost staffing levels? because of that? That seems like a lot of oversight.
No, to a large extent, it does just mean a more regimented regime when people are in those facilities. Yes.
On the border, the border around Auckland, sorry. Residents of Port Waikato say that they have been left in the lurch, basically. They've got to drive to Huntly to get food and petrol supplies, as opposed to being able to go to Tuakau. What's the issue there? Can that be changed?
So the police, I believe, are the government, well, all of government group and the police are working on that issue at the moment. I haven't got the most recent update in the last sort of 15 minutes or so, but I know that there's conversations going on about how to address the issues and the concerns that have been raised there.
Specific to that town?
Yes, so that particular issue is being looked at as we speak. Yes.
Testing, if part of the issue is sort of a lab capacity and reagents and so on, is there an ability to pool test saliva tests like nasopharyngeal ones where?
So it's not lab capacity that I'm so worried about at the moment. It's the capacity to do all of this testing. So we have to weigh all of those things up. But look, I think the key message here is we're not ruling anything in or out. We're always looking at how we can continue to strengthen our testing regime to give us that much more reassurance. Jessica, you can have the last question.
Dr. Bloomfield, on the new clinic, there have still been lots of reports of long waits today, even with the extra resources. Are you looking at pumping more resources in there, and is help on the way for those people queuing up?
Well, we're certainly in contact with the DHB there. I know they had put in quite a lot of additional capacity, and we'll keep in contact with them during the day to see if they need additional people.
So you will send in more if they need it?
Indeed.
All right, thank you very much, everyone. We are out of time. I've got to get to the house. Thank you.